It's 6:39, and a recent study shows suicide with firearm among elderly has increased 50% in the last 10 years. KTSN 9 News reporter Carla Draxler is live in the newsroom with how the pandemic has impacted suicide. Good morning, Carla.
Good morning, Jay. A study done by New Mexico State University professor Dr. Jagdish Kupchandani suggests this immense increase in elderly suicide, but he says that these numbers could increase even more because of the pandemic.
Isolation, pain, and firearms. Recent studies showing firearm suicide among elderly grew almost 50% from 2010 to 2018.
The older people have been more isolated, have delayed their mental health or physical health care, and they still continue to live with guns at home. Almost 1 in 4 older people have guns at home.
Now with the pandemic, Dr. Jagdish Kupchandani, public health professor at NMSU, suggests these numbers will climb even more.
Given the pandemic and how life will change now, healthcare providers have to think of out-of-box ways to provide healthcare to older people.
Less accessibility to healthcare and the challenges of new technology are making the suicide pandemic even worse.
The communities have to put in a lot of effort to ensure that older people are not left alone or isolated.
Dr. Fabrizio Delgado, psychiatrist with Texas Tech Physicians of El Paso, says the amount of patients he's seeing is frightening, most of them being 50 years and older.
I've seen firsthand the amount of patients, the increase in the number of consults for suicide attempts. Of course, we don't see completed suicide because at that point it's too late, but the amount of patients that we've been seeing with attempted suicide is terribly high, and I feel like this pandemic has hit our borderland community very hard.
He urges the community to reach out to their elderly and simply ask how they're doing, a question enough to save a life.
And checking on your elderly family members, your neighbors, asking them how they're doing and if they need any help can go a long way. Reporting live in the newsroom, I'm Carla Draxler. Back to you.